frequently asked questions on speech and language delay in children. What is the definition of speech in language? Speech is the verbal production of language, whereas language is the conceptual processing of communication. Language includes receptive language, understanding, and expressive language, the ability to convey information, feelings, thoughts, and ideas. What are the causes of speech and language delay in children? Types of primary speech and language delay include developmental speech and language delay, expressive language disorder, and receptive language disorder. Secondary speech and language delays are attributable to another condition such as hearing loss, intellectual disability, autism spectrum disorder, physical speech problems, or selective mutism. What is the prognosis? Severe speech and language disorders in young children can negatively affect later educational achievement, even after intensive intervention. The likelihood of persistent difficulties for young children with speech and language problems appears to be directly related to the range of language functions that are impaired, with the best prognosis for children who have a developmental speech delay. What is normal speech and language development? Normal speech progresses through stages of cooing, babbling, words, and word combinations, whereas normal language progresses through stages of understanding and expressing more complex concepts. Development of proficiency in vocabulary and language use depends heavily on family and early school experiences. Families can aid their children's language development by telling stories, playing word games, reciting rhymes and songs, engaging in questions and conversation, and reading books together. The proportion of a child's speech that should be understandable to a stranger in the absence of any contextual cues increases with age. Milestones for this can be remembered by using the rule of fours. If the child's age in years is divided by 4, the quotient is approximately equal to the amount of speech that should be understandable. What is the evaluation for speech and language delay? In children not meeting the expected milestones for speech and language, a comprehensive developmental evaluation is essential, because atypical language development can be a secondary characteristic of other physical and developmental problems that may first manifest as language problems. What are the indications for referral? All children with suspected speech and language delay should be referred to a speech-language pathologist or local early intervention program for formal assessment. All children with suspected speech and language delay, or in whom there is concern about hearing loss, should be referred to an audiologist. What is the treatment? The primary goals of therapy are to teach children strategies for comprehending spoken language and producing appropriate communicative behavior, and to help parents learn ways of encouraging their children's communication skills. There are good data available to support the effectiveness of speech-language therapy, particularly for children with primary expressive language disorder. Parents can effectively administer speech-language therapy, but must first receive training, typically from a speech-language pathologist. Therapies lasting longer than 8 weeks appear to be more effective than those lasting less than 8 weeks.
Audio Jungle. Audio Jungle.